CoolSculpting should have deep involvement of the doctor. Yeah, because I think it sounds a little bit easier than it actually is. So firstly, I think the doctor, being a doctor, has got a better understanding of how the body functions and what will lead to better results. And more importantly, the doctor also assess to see what can go wrong. I think in life, we want to make sure that nothing goes wrong before we think about what can go right. So the doctor will find out whether you have any medical conditions, like certain conditions which are sensitive to cold involving the blood, should not have CoolSculpting done. And for other people, like maybe people with cold urticaria, whereby they have got rashes when exposed to the cold, perhaps certain medications could be taken before CoolSculpting in order to get the job done without any complications. And number two, I think the doctor has got a better idea as to what might lead to a more efficacious and a more effective result. Nevertheless, no matter how experienced the therapist is, I think CoolSculpting is still a team effort. Okay, so when the doctor does the plan, that's precisely the most important part about the treatment, because after that, because the machine is so high-tech, you really don't have to change many settings, and it's just about putting the applicator on the right place. So the doctor's involvement is really in planning, and that's really the value add. The doctor will assess the fatty bulge and use a whiteboard marker to draw.
What I gather is that doctor's involvement is very important, because it is, after all, a doctor would need to know what, if there's anything that the patient is...
Yes, you come to a clinic because there's a doctor, so the doctor is there to care for you. So if there's anything or any question, you are always there to ask the doctor.
So doctor, you talked about what can go wrong. So maybe you can we find out more about what exactly can go wrong during CoolSculpting?
As with everything, with great power comes great responsibility. Yeah. So if something is really, really powerful, you need to make sure that you're responsible for it, and you also have to make sure that it's well controlled. So as you said, if the temperature goes below -11, you can get cold burns over the skin, and that can lead to disastrous consequences. And of course, if you don't want to take this responsibility, if the doctor's not around, if you're afraid to cause problems, for example, the cryolipolysis machines in a spa, whereby the doctor's not present, then chances are the power's tuned down a little bit to make sure that it's done safely. However, below -9 degrees, you will not get any lipolysis. So therefore, the key is that you have selective lipolysis, whereby you have lipolysis, which is the breakdown of fat, but at the same time, having the skin and the other tissues not affected for the long term.
I see. Okay, so a cheap treatment might end up being expensive, because if it's not done correctly, then I need to do more to get the result that I want. So
or you might not get the result you want at all if it doesn't reach the correct temperature, or you might get what you don't want if it's too cold.
I see.
To damage your skin, yeah.
Okay.